Accomplishment that I'm proudest of is graduating from medical school and completing the Medical Scholars Program, the MD-PhD program at the University of Illinois. I'm the first in my family to become a physician, namely because so many of the previous generations of my ancestors were not given the same opportunities or afforded the same opportunities educationally and professionally that I have been able to benefit from as I've grown up. I have certainly benefited from all of their hard work to create the space for me to be able to access those opportunities and pursue my career path. I'm also excited about it because the other degree that I obtain is focused in community health. And community health and health policy are things that are extremely important to me as I've continued to grow in my career because I'm able to use that skill set to ask research questions and get data and influence policy that looks to close the gaps in health disparities and health outcomes and to make sure that all of our residents have access to meaningful, equitable healthcare that makes sure that they actually are able to enjoy good, solid, positive health outcomes and have longer life expectancy. There are lots of important issues in our US healthcare system today. Being a pediatrician, so much of our pediatric care model is built upon waiting for the child to be symptomatic or in crisis before we step in and address their needs, and as opposed to building a sustainable culture of prevention for both physical and mental health. We need more investment in the public health and population health approach, specifically related to children, and a greater commitment from the payer system to support building and sustaining a culture of prevention and inclusion of support services to address many of those social determinants of health that we know significantly impact a child's ability to be healthy, such as case management and addressing housing insecurity, food insecurity, et cetera. We cannot wait to intervene to help children for them to present in crisis or extremely symptomatic before we step up and address their issues. I'm a big advocate of self-care, and in some instances, some of my coworkers and colleagues have identified me as the self-care policeman. I think it's important to identify things that bring you pleasure and joy, and also things that you can learn from and learn new skills. And it's important to invest time and energy into those activities. And that can range from a whole host of different things. For me, I love to play tennis. So I'm active in the tennis community, playing tennis, playing tournaments, playing in different venues. I also enjoy watching cooking shows. I won't necessarily say that I cook well myself. I can, but I do enjoy learning new things and learning about different cultures as well. So, in summary, investing in some type of self care that brings activities that bring you joy and also allow you to learn and grow in different ways.